All right. Welcome back to another audio lecture discussing alterations in ventilation and perfusion. And in this audio lecture, we're going to be talking about atelectasis. So, atelectasis is when the alveoli collapse on themselves, right? And this creates both a ventilation and a perfusion problem. So, remember that the lung, when it undergoes the local control from the pulmonary tissue, it actually avoids hypoxic areas, right? So in the rest of the body, we see that the hypoxic areas are really vasodilated. We want to get more blood flow, and so in this region of the lung that is not exchanging gas, we don't want to we don't want to perfuse that with blood. So we see this alveolar collapse. It reduces gas exchange, first of all, by not allowing inflation of the alveoli, and then also creating regions of hypoxia. So thus for avoiding blood flow or perfusion. So what causes this atelectasis? So we see that surfactant deficiencies, kind of like what we see in emphysema, um, and that type 2 alveolar cells can be damaged and they can have reduced the production of surfactant. If your bronchus is exposed or if it's obstructed, okay, it's going to block it, and then it's not going to allow it to be ventilated with air. Lung tissue compression, so just like trauma to the chest. Then, so if you take a hit to the chest too hard, it can cause the lung to collapse. Right? Another area is going to be increased surface tension, right? So, especially on the inside of the lung, we can see that the alveolar space, and this has to do with surfactant deficiencies. So the surface tension of the alveoli increases a substantial amount, and then it really wants to kind of pull it forward and pull it closed. We see that lung fibrosis could have a collapse of the lung alveoli as well. So, what are the manifestations for atelectasis? We see that these manifestations include diminished breath sounds. So, because you're not inflating the entire lung, like dyspnea, so we're going to see labored breathing, tachypnea, so this rapid ventilation rate. And so, when you actually see the air movements in the chest, now you're going to see asymmetrical chest movements because there's one side of the chest that is not moving terribly well, and it's not moving to the same extent that the other one is moving. Yep. We know that anytime you have hypoxia, this sense of anxiety can creep over you. So we see anxiety as a manifestation of this. Restlessness is due to some neural problems, right? So anytime that we cut off oxygen, we're cutting off supply for ATP production. Okay? Tracheal deviation and tachycardia, right? So these efforts are, so the tachycardia, the hyperventilation, the labored breathing are all a result of the collapsed alveoli, and the tachypnea and the tachycardia are specifically mechanisms to try to get more oxygen into the blood. Okay. Diagnosis, we're going to take a patient history, asking them about any kind of recent events that have happened, and then we're going to just collect a physical manifestation list, and then we're likely going to perform a chest x-ray. So if we look at this x-ray over here, you can see a full lung indicated by the black, right? So the left and right lungs are there, and then we have a lung over here that is a collapse. So that's we have an atelectasis happening right here. There is the lung, and so you can see that it is collapsed on itself. So now the internal pressures of the surface tension inside the lung, inside the alveoli, have forced that lung to collapse. Right? So a chest x-ray is going to show this, and the CT scan is also going to show this. So a CT scan is really just a three-dimensional x-ray, and so it allows multiple angles and viewpoints to be collected. We are likely going to do a bronchoscopy, so now we're actually going to take a camera, we're going to move into the lung and see see if indeed that we have a blockage of the bronchi, or to look for the specific collapsed lung, even though the x-ray has already told us that. So we're going to expect arterial blood gases to show deviations in that PO2 is going to be depressed, carbon dioxide is going to be increased because of the decreased exchange that is occurring. For the CBC, we might expect polycythemia to be present. So here you're going to increase blood cell production so that we have the ability to carry more oxygen. All right, so treatment of atelectasis, we're going to try to reinflate the lung. That's what all these mechanisms are targeted towards, except for the antibiotics. And the antibiotics is due to if you have a bacterial infection that generated this this fibrous tissue, likely damage the alveolar type 2 cells. We could use incentive spirometry. So this is incentive spirometry over here, where we're trying to measure the high X current flow, right? So this high X current flow, we're trying to reach certain limits. Remember that our total maximum lung capacity is about 4,000 milliliters, so that would be an incredible breath right there, because we always have a residual lung volume, right? So we don't ever empty our lungs completely. So if we see a 4,000, that value is really high. So that value also includes the anatomical dead space. So we might use continuous positive pressure, and so what this would be pressurizing the air that is going into our lungs, right? So now we are actually causing the lung to actually inflate by using this continuous positive pressure. And then the same idea would be here. So with the endotracheal intubation with a mechanical ventilator, we're going to use a continuous positive pressure to reinflate that lung as well. So, like a lot of these, the best way to actually treat it is to have complete prevention. And so we see that increasing mobility is going to reduce the presence of atelectasis. Coughing really mobilizes secretions from your lower respiratory tract, and it really gets your alveoli involved in the process of air movement. Deep breathing does the same thing, except that it's not as violent of an exercise. Effective pain management, so giving analgesics wherever possible, and then incisional splinting. So incisional splinting is when, like, you have an incision inside your thoracic cavity or abdominal cavity, and those movements can cause pain, and they can cause it to a pretty high amount of pain. And so rather than experience the pain, really we want these individuals for incisional splinting to kind of press on that area when they're inhaling or coughing or whatever it is, whatever the respiratory movement is. But this should try to reduce the pain, and this is a pain management technique. All right, so that is our lecture over atelectasis. So until next time.